Welcome back to the Dr. Laura Shaheen channel, where we talk about all things fertility and reproductive health. I'm Dr. Laura Shaheen, and today we're going to do a deep dive into a fascinating topic, the unicornuate uterus. I didn't say unicorn uterus, unicornuate uterus, which is a uterine anomaly that can impact fertility and pregnancy. We're going to talk about what it is, how to diagnose it, what to do if you know that you have one. You're going to learn so much about this important topic. Let's get started. I'm Dr. Laura Shaheen. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build families and be diagnosed with unicornuate uterus and other uterine anomalies for over 20 years. And I love educating. If this is your first time finding this channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. There are two other ways to stay in touch. Number one is my weekly podcast, the Baby or Bust Fertility Podcast. Listen anywhere you listen to podcasts. I do interviews with fertility warriors, experts in the field, and sometimes I do solo, really in-depth education topics for the episodes, but you will always learn something fascinating. Subscribe wherever you listen to your podcast so you don't miss that weekly episode. The other way to stay in touch is to sign up for my newsletter. There's going to be a link in the description below. My weekly newsletter is all about fertility in the news, updates on content I've created that week to help keep you educated. And I always have recommendations for products or books that I recommend for you. Now, today we're going to talk about a really interesting topic, a unicornuate uterus. I was inspired to cover this topic because I saw a TikTok by the famous influencer, Selena Speakyboo. You have probably seen her. If you don't follow her, 28 million people follow her on TikTok and 3 million follow her on Instagram. And she has done an amazing job of sharing her fertility journey. And she recently posted this video answering some questions about her journey. She talks about how she has a unicornuate uterus. And I was so surprised. I mean, this is something that I've definitely helped in my own practice and helped patients with, but I'm just so thankful that she's been so open about her journey and sharing that she has this uterine anomaly, because I have been flooded with people sending me this TikTok, or whether it was on Reels on Instagram, and saying like, hey, I have a unicornuate uterus. Can you please do an in-depth, information, educational video or in-depth episode on your podcast about this really important topic, because it impacts me? And I said, yes, that is great. This is something that is really important to cover. Although it's not overwhelmingly common to have a unicornuate uterus, when you do, you want to learn as much as you can about this topic, and that is what we're going to do today. We're going to go over 6 main topics. Topic number 1, exactly what a unicornuate uterus is. Topic number 2, how common it is. Topic number 3, diagnosis. How do you know if you have one? Topic number 4, impact of a unicornuate uterus on fertility. Topic number 5, impact of a unicornuate uterus on pregnancy outcomes. And topic number 6, treatment options. Now stick around to the end of the video where I give you really important questions to ask your doctor if you get this diagnosis, to help you advocate for your care. So topic number 1, what is a unicornuate uterus? It is a rare, but not that rare, uterine anomaly. It's meaning that the way the uterus formed when that person was in utero as an embryo, the way the uterus formed didn't form into a typical shape that you see in anatomy books, but it only formed 1/2 of the uterus. So I've got an image here. You can see on the left side a normal shape of a uterus, the upside down triangle, fallopian tubes coming off to both ovaries. And then on the right is a unicornuate uterus. And it's basically like half of the uterus. And the way I explain it to patients is we, meaning I have a uterus. So if you have a uterus, the way it forms is it actually is formed in 2 separate uteruses. And I always do this with my patients when I'm describing any kind of uterine anomaly. I use my hands. So we start off with 2 separate uteruses, 2 cervixes, and like the fallopian tubes come off the top and they kind of are close to the ovaries. We start off with 2 separate uteruses, and then they come together. And there's a little fibrous band in the middle that goes away. And that is how the normal shape of the uterus, or the most common shape, I hate the word normal, is formed. But there can be uterine anomalies across at any time. So there are people that are born with completely 2 separate uteruses, two cervixes, two vaginas, like two completely separate reproductive tracts. There are other people that are kind of born with two uteruses, but maybe one cervix, or people have what's called a bicornuate uterus, where there's just kind of like a heart shape or a dip at the top, or some people have something called a septum, where the final stage where that fibrous band doesn't go away. So at any part along this amazing formation of the uterus can get disrupted, and you can have uterine anomalies. Now, for a unicornuate uterus, it's not even just that. There's many different types of unicornuate uterus. So there are four main types of unicornuate uterus, and I've got a picture here, and let me explain them. There can be basically just what I showed in the beginning, just one side of the uterus developed and the other side completely did not develop. That's called no horn. There's no like little small remnant, just one kind of, they call it a banana shape often. If you're looking at an MRI or something like that, just looks like kind of one side of the uterus was formed. And then the other three types, there is a little remnant of the second side of the uterus, or the unicornuate side. It's smaller, it's underdeveloped, but there's three main types of that. There's one that's communicating, meaning that there's a uterine lining in that little remnant, and it builds up and it sheds and it kind of comes out of the body with menstrual cycles. That's a communicating unicornuate uterus. One side's just underdeveloped. The other can be underdeveloped side, non-communicating. There's no uterine lining. It's not really functioning. It's just sort of like a little remnant. And the fourth kind, and this is important to know because this can cause symptoms, is a non-communicating remnant of a little horn. So you've got like the big side that's acting like a typical uterus, building up with the lining and shedding. And then you have this little unicornuate remnant, but it's actually got active endometrial lining, and that can build up, lining and blood, but it has nowhere to exit. It's not communicating. It's not coming out of the body. And that can cause symptoms of pain as people are menstruating. And that's something that people could be diagnosed early in life because they're having symptoms. Other people might not get diagnosed until later in life, sometimes never, because they have no reason to have imaging of their uterus, or there's no fertility or pregnancy problems, there's no symptoms. So you can have symptoms and get a diagnosis, or maybe not. But this is what a unicornuate uterus is. It's a uterine anomaly. It happens while we were being formed inside our mom's womb, and there's different types. Topic number 2, how common is it? It's actually pretty rare. It only impacts about 1 in 1,000 people with a uterus that we are aware of. It's hard to diagnose because, as I talked about in the first topic, some people have symptoms that lead to a diagnosis. Other people don't have symptoms, and if they have no reason to have imaging of their uterus, some people might not even know that they have it. And so this is our best guess. Our best estimate is 1 in 1,000 people will be born with a unicornuate uterus. Topic number 3, how is it diagnosed? Usually with imaging. So if someone has symptoms and they find out that from imaging that they have it, great. Or somebody's having imaging for some other reason and it happens to be discovered when they do a pelvic MRI or pelvic ultrasound, or people are having an evaluation for fertility or in pregnancy and it's discovered that way, but it's usually imaging. So this is an image of both 3D ultrasound imaging of a normal and a unicornuate uterus, and on the bottom, it's imaging from a hysterosalpingogram or an HSG. This is where we put fluid into the uterine cavity and watch it spill through the fallopian tubes. So you can see what a normal uterine cavity looks like an upside down triangle. And then on the right is a unicornuate uterus. So it's sort of off to the side. You can kind of tell there's only one side of the cavity that's being filled up, and therefore only one fallopian tube is spilling kind of in that imaging. Let me show you a little bit closer. Here's a close-up of the hysterosalpingogram images. So again, if you have this test, I have a couple of videos here on YouTube that can really explain what to expect from this test. This is a typical test done especially in a fertility setting. So if someone is not getting pregnant, people often have imaging. Sometimes it's an ultrasound, oftentimes combined with a hysterosalpingogram to make sure that the inside of the uterine cavity is nice and normal and both fallopian tubes are open. And so on the left, this is what a normal uterine cavity looks like, an upside down triangle. And on the right, this is what a unicornuate uterus would look like like on an HSG. It's just like one side of the uterus is filling up. Here is a close-up of the 3D ultrasound imaging. So this is really cool imaging. It's basically doing an ultrasound with a vaginal wand to get close to the uterus. And then it's taking a bunch of ultrasound pictures and then putting them together kind of in a 3D structure. And so on the left, this is what a normal uterine cavity looks like on 3D ultrasound. And on the right, this is what a unicornuate uterus looks like. So it's just kind of like one half is there. You can see a unicornuate uterus with an MRI, but I think the images are much clearer with a 3D ultrasound or a hysterosalpingogram, kind of putting it into context. Sometimes people are diagnosed at surgery. Sometimes people will have surgery for whatever reason, a laparoscopy. And if the uterus is examined, people will say, oh, this is not a normal uterus. We actually only have one side that's available, or they might see a little remnant of a unicornuate uterus like we discussed earlier. Topic number 4, how does having a unicornuate uterus impact fertility? A unicornuate uterus can present as fertility challenges, but not always. There are people that get pregnant easily and have beautiful babies with a unicornuate uterus. It is not an absolute that you will have fertility or pregnancy challenges if you have a unicornuate uterus, but it can happen and it can come up in a fertility evaluation and should be explained and discussed given the patient's personal situation. There is one study by Chen et al. That was published in 2018 that did look at over 3,000 patients with a unicornuate uterus and did find that about 23.7% of the time, those patients had fertility challenges. So that shows you not everyone with a unicornuate uterus will have fertility challenges, but in this particular study with a really good number of patients, they found about a 23% risk of fertility issues. Why would someone have fertility challenges with a unicornuate uterus? Hard to know for sure, but theories include that maybe the uterine lining isn't building up thick enough to allow implantation. There could be some sort of implantation issue or uterine issue with the communication between the embryo. There is some evidence in some studies that show a slightly higher risk of an ectopic pregnancy if someone has a unicornuate uterus or other uterine anomalies. That's a pregnancy within the fallopian tube that is not viable, cannot continue to grow, and that can absolutely be a fertility challenge, especially if that's happening over and over again. Other patients can present with recurrent miscarriage, and they can find a unicornuate uterus within their evaluation. And the thought is that maybe that uterus is a little bit underdeveloped and is not able to sustain a pregnancy for much longer than the first trimester. So the influencer, Selena Speaky-Boo, that I mentioned at the beginning of the discussion, she was answering questions about her fertility journey in that content. And she said that she's actually using a gestational carrier or a surrogate because she has a unicornuate uterus. I do not know her whole story. I am not her doctor, but I just want you to realize that not everyone that has a unicornuate uterus will need a gestational carrier or a surrogate. I just want to really make sure that that is clear. Not everyone will have fertility challenges. Not everyone will have recurrent miscarriage. But in that content, Selena Speaky-Boo, it sounds like her journey is going to be through a gestational carrier, and I'm just wishing her the best on her journey. Topic number 5, what are the pregnancy risks with a unicornuate uterus? What you worry about the most is miscarriage, preterm labor, maybe growth restriction or small for gestational age for the baby, and some placental complications like placental abruption or inability for the placenta to fully grow if someone has a unicornuate uterus. Now, all of these do not happen for everyone that has a unicornuate uterus, but if someone has a unicornuate uterus and they do conceive, this could be something that your doctor is talking to you about. You might have more ultrasounds in pregnancies to watch the growth of the baby closely, and it's just something that might be considered. Your doctor might have you have a consult or even be followed by a high-risk obstetrician in your pregnancy. But again, not always. There are people that have had full-term, gorgeous pregnancies and deliveries with no complications with a unicornuate uterus. I have personally diagnosed people with secondary infertility and found a unicornuate uterus. So these are people that had a baby or even 2 babies before, and then they're struggling to conceive. And I find that they have a unicornuate uterus. I do not think that that particular issue is causing their issues with fertility because they already had a live birth, term pregnancy. But so just giving you lots of different perspectives, I do think it's important to understand the risks, but also really take it into context. So there is one study that specifically looked at risks of preterm labor. This is by Chan et al. It was published in 2011, and it found that up to 50% of pregnancies with a unicornuate uterus did have preterm delivery. So that doesn't necessarily mean that they all had long-term issues, because preterm just means being delivered at less than 37 weeks gestation. So I think that there is a higher chance of being delivered early or going into preterm labor early, but that doesn't necessarily mean any long-term issues for the baby or the health of the mom. Topic number 6. Treatment. How can unicornuate uterus be treated? While the uterus itself cannot be fixed, and I put that in air quotes, you can't surgically make a unicornuate uterus into a full functioning uterus. There are some instances where surgery is indicated. So remember when I talked about the different types of unicornuate uterus, and there's one that is a non-communicating unicornuate uterus. This is the type of unicornuate uterus that can present with pain with periods or pain in general, as that fluid, the blood, the menstrual flow is building up in that non-communicating horn of the uterus because it has nowhere to escape. And so in that case, patients will often get a laparoscopy and have that horn removed to help decrease the pain and the symptoms that they're having. There are some of my patients that have used IVF to help with conception. Sometimes there's some anatomical reasons why they're not getting pregnant. And so sometimes you can use IVF to get the eggs out of the body, create embryos in the lab with sperm, and then when the embryo is ready, place it into the unicornuate uterus to conceive. Or sometimes, like the influencer Selena Speakyboo, she is using IVF to get eggs out of the body, create embryos in the lab, and then transferring the embryos to a gestational carrier to help build her family. Another treatment or intervention is if someone is pregnant with a unicornuate uterus, they are often followed closely in pregnancy, like we talked about, looking for signs of preterm labor, making sure that the baby is developing and growing appropriately, looking for any sort of placental issues, so they could be followed closer in pregnancy. I'm glad you stuck around to the end of the video because I want you to be able to advocate for your care. If you get this diagnosis, here are some questions I recommend that you ask your doctor. I can think of 5 questions. Number 1, how will a unicornuate uterus impact my fertility? It may and it may not, but it's important to get a consult in your personal situation. Question number 2, are there any additional tests that I should get? Unicornuate uterus or any uterine anomalies can also be associated with anomalies or irregular development along the urinary tract. So sometimes people who have a uterine anomaly, whether it's unicornuate uterus, bicornuate, Delphus, etc., they can also have duplicating ureters, sometimes a missing kidney. So lots of different issues along the production of not only the reproductive tract, which is the uterus and the ovaries and the tubes and the cervix and the vagina, but also the urinary tract, like the kidney and the ureters and the bladder and outflow. So sometimes people will get additional testing of their urinary tract after they are diagnosed with a uterine anomaly. So ask about that. Question number 3, what are their treatment options if I want to conceive? Question number 4, what steps should I take to ensure a safe pregnancy? Question number 5, should I have a consult with specialists, like a fertility specialist, like a reproductive endocrinologist like me, or a high-risk obstetrician like perinatologist or a maternal fetal medicine doctor to talk about monitoring and guidance in pregnancy? So in conclusion, we have learned so much about a unicornuate uterus. I hope this was helpful. It can be an overwhelming diagnosis at first to learn, oh my gosh, I have an anomaly. I was born this way. What does this mean for fertility, miscarriage, pregnancy? It can be overwhelming, but I hope that the information that you got here today will make you more knowledgeable and help you advocate for your care. And I really want to emphasize, even though we've talked a lot about some scary risks, with fertility challenges or pregnancy challenges, that doesn't mean that that's going to happen in your personal situation. I'm going to have some references in the description below, some of the links to the studies that I mentioned. Also, the American Society of Reproductive Medicine has a really updated, clear guideline of how uterine anomalies are described because it has not always been universal. So I hope that those links are helpful. Like this video if you learned something, comment with questions that you have. Be sure and subscribe to this channel so you get my weekly videos all about reproductive health. And until next week, wishing you love, luck, and pineapples.